Hello and welcome to this week's edition of NHIS in a Week. In the headlines, Quality Assurance Directorate trains staff on revised credentialing tools. Provider and Client Relations Unit embarks on public sensitization exercise. And orientation of staff across the country on new digital platform continues. Now to the details. The Quality Assurance Directorate of the authority engaged its staff on the revised credentialing tools in a training held last Friday. This move by the QA is to get all staff in tune with the new ways of credentialing. Now, a 4-member team from the Provider and Client Relations Unit of the Corporate Affairs Directorate embarked on the 5-day sensitization exercise at the Kaneshie Markets and its environs, STC Transport Yard, and the Circle Lorry Station. The aim of the exercise was to educate the public on how to link the NHIS card to the Ghana card. It was also intended to educate the public on the existence of the call center, the WhatsApp platform, updates of NHIS members' telephone numbers on the biometric membership system, and the exemption of 70 years and above from the 1-month waiting period. The leader of the team and the manager for Provider and Client Relations Unit, Eric Bwediafuakwa, talks about the focus of the exercise.
So the Provider and Client Unit of the Corporate Affairs embarked on sensitization and education program, and our focus was to educate members on certain innovations of the organization. One is how to link their NHIS membership to their Ghana card, and then CEO recently introduced the waiver for 70-year-old members. That is to say that when they renew their membership, even after expiry, they wouldn't go through waiting period. It will automatically be active. And then we were also out there to ensure that members know of our call centers. Ways through which they can communicate with us in case they have challenges at facilities or at the point of services. We observed that most of our members don't even know about the star 929 short code to renew their membership, and they still walk all the way or travel all the way to our district offices just to renew membership. So through our activities, we were able to educate them on the use of the star 929 to renew their membership, as well as using the same star 929 to link their NHIS to Ghana card.
Mr. Eric Bwediafuakwa added that the introduction of the mobile renewal of membership made the exercise easier for the team. He touched on the process of renewal.
So I would like to take the opportunity to educate members on how to renew their membership using the star 929 short code. So step 1, you dial star 929 hash on your mobile phone. Usually you should do it on a Momo registered number. So after dialing star 929, you select option 2, which gives you access to renew. And then you move on to the option where you'll be required to input your NHIS membership number. So you check and enter the 8-digit NHIS membership number. After entering the NHIS membership number, it will request for a confirmation. You re-enter your number again, and then you press send. After sending, it will redirect you to the payment option where you will be asked for your Momo PIN code. So after entering your Momo PIN code, you should receive a message that confirms that your NHIS membership has been renewed.
Moving on, the project team made up of staff from the Corporate Affairs Directorate, Membership and Regional Operations, and Management Information System Directorate have embarked on a nationwide sensitization exercise to create awareness and train NHIS staff on how to operationalize the digital platform. Mr. Oswaldisia Mensah, Acting Director of Corporate Affairs, who doubles as the project director, led one of the teams. The 2-week staff training completed last weekend.
Now, NHIS, through its design, of course, is the only government agency that is responsible to ensure that we provide access to healthcare for the population of Ghana. NHIS, again by design, is the only public institution today that has a benefit package, which again our population will enjoy for healthcare services. And in doing all of this, we must ensure that our members achieve healthcare or have access to healthcare services without having to pay undue financial hardship, in accessing healthcare. So we are quite determined. As we speak today, Ghana's active membership, or NHI's active membership, is 16.7 million active members as at the end of 2021, which represents about 54% of Ghana's population. We are on a mission to be sure that as a country we can give at the minimum 80% of access to healthcare to all Ghanaians, if not 100% by the year 2030. The application is free to download, and it's so easy to use and so convenient. You do not need to pay anybody any money to be able to access the service. We're going to try and hammer this information down to make sure that it penetrates, and we'll count on you, the media, to also support us to make this a reality. I mean, one of the things you cannot control will be people's attempt to scam and attempt to, as it were, fleece people out of pockets. But as much as possible, where the awareness has been created that this application is for free and so easy to use, even your daughter, your granddaughter, or anybody who can just download the app can assist you to register yourself and other people onto the scheme.
Now to our final story. The second team from the NHIA, made up of Mr. Joe Anodakwa, Project Manager, Vida Educhumwa Boateng, in charge of Project Marketing and Communication of the team, and the Greater Accra Regional Director, Mr. Ben Brown, has embarked on a sensitization exercise on the new mobile app in the Central, Western, Western North, and Northern regions. Speaking to the directors of the respective regions, they admitted that the app has come at the right time to inject vibrancy in the scheme and boost enrollment in Ghana's attempt to achieve UHC.
Thank you. The NHIS is moving to universal healthcare, and there are several innovations that were brought on board. The mobile renewal, the linking with the Ghana card, the e-claims payment and management, and now the new one bringing on board is the new app that will enable members get new card, renew their card at any place of their convenience, and it's a good that authority is bringing on board, and all must embrace it.
Okay, and so what are the dynamics in your region when it comes to enrollment, and how will the app support your work?
For now, as a region, our membership, we targeted 50% of our population. At the end of September, we've achieved roughly 41%. More needs to be done. So the new app, with the help of the managers, with the help of the PROs, are going to do more education to ensure that the new members who are not on board and those who have also not renewed their card should be on board. So we believe that at the end of the year, we will get beyond the 50% that we've targeted.
I'll have to say that it has been a very exciting time. Very exciting because NHIS is an institution that is always looking forward. We are not waiting for people to come and complain to us, this is it, but we also have our own inner mechanism for assessing how to make our operations much better, and that will carry the public along. I'll say that the new app that is being developed, or that is going to be launched very soon, it's an insight. Just looking, sitting for or sitting during a meeting, I thought that we have done this, one of the greatest innovation that the scheme has brought, or the authority has brought to bear. Ghanaians are obviously going to enjoy from this, and we have taken it that after this, all district and officers will be educated on this. We'll also meet providers to educate them about the need for them to hook on onto this particular app. We are also looking at how to do a massive public education. As you know, the NHIS, we are going to have our NHIS month. We want to plan to make sure that as part of the program, we go on an education drive. Along with telling people to enroll, we also want to make it part of the program to make sure that people really hook on onto this particular app. I will say that the trainers, all the facilitators have been very excellent. There was a blend of male and female voice who actually know their way. We're very grateful for this. We hope that many of these particular trainings will come from the head office and video department, so that we keep ourselves abreast of all the things that are happening within the NHI.
But today's meeting has been a very successful one, and it has been very interesting. And it is good to know that NHI, we are still making inroads. We are coming out with more innovations, and this one is going to help reach out to many of our members. It is an easy way out for our members to access numerous benefits or services that we offer as an organization. And like we said, it will also hasten our march towards the universal health coverage in 2030.
This week on Health Tip, we take a look at uterine fibroids. Now, this is how we draw the curtains on today's edition of NHIs in a Week. For more stories, visit our website on www.nhis.gov.gh and follow our social media platforms displayed on the screens. My name is Angela Siedu. Thanks for watching.